Okay. Okay, well, welcome everybody. Welcome to the Public Health Liaison check-in. I am joined today by our wonderful public health nurses, Linda Metz, Sandra Rosenblum, and Marcia Grant, and they're going to be helping us out today. Dr. Lisa Santora has a much-deserved day off today, so she won't be joining us. So basically what we're just going to do is just really quickly go over kind of all of the new documents that are involved with now that we're in tier 3 and the orange version of the tiers. So we'll go over those really quickly, talk about some of the changes that you'll see in all the documents, and then we'll take a couple questions, and we're going to get you guys out of here a little bit early, maybe around 3:30, so you can go and start to use all these documents and deploy them into your schools. So we'll just start with a couple slides here. So again, just to reiterate, we're in the moderate tier, which is tier 3 and orange. You'll see a lot of our documents that had a lot of red in it before are now orange, so that you can kind of tell the difference between the tiers, because a lot of the stuff is the same with a lot of, slight differences in wording. So it's going to be really easy for you guys to kind of be able to see the difference between everything. All of our documents right now, not only are they on the Marin Health and Human Services site, but we also have them on the Rethinking Schools site on the documents page, and the link is right here. I will really quickly put it in the chat box. There you go, so you can get all those documents there. So there's 3 new documents. There's the Student and Family COVID Safety Handbook. We have that in English and Spanish. We have the updated decision tree, which you saw kind of a draft version of that last week, and we have that in English and Spanish as well. And then we have new exposure protocols in English and Spanish. Not too much has changed with that one, except for that first scenario 1. So we did update that, and we also have updates on the symptom cards that that the nurses and the staff can actually use if a student has symptoms, to hand to them to give to the parents, so they understand kind of the next steps with the symptoms and staying out of class. So I'm going to go ahead and pass it along to one of the nurses, who's going to talk a tiny bit about the handbooks and some of the changes. And I'm going to bring the document up so that you can see that a lot of the changes are highlighted in yellow, so that you don't have to figure it out on your own. Do you guys want to talk about the changes?
Yeah.
Okay.
I was waiting for the document to come
Oh,
up
sorry.
on the screen there. I don't know if folks are going to be able to read that, or if I am. So there's the changes for tier 3 are really just in a few areas, aside from the nice new color scheme. I actually can't read that at all. Is there a way to zoom in?
Yes.
I imagine other people are in the same boat.
Beautiful.
Better?
Oh yeah, here we go. Yeah. So very similar to the previous version, and the changes are highlighted. So basically a reminder not to gather with more than 3 households. And we have an increase in the number of cohorts that kids can participate in. Now, this was not an order, and it still isn't. It's a recommendation, a strong recommendation. So that is a big difference. The other difference has to do in how we look at the symptoms. The tier 1 and 2 decision tree, it was pretty strict. If you had one of many symptoms, you would be out of school and needing to test or stay out for 10 days or get an alternative diagnosis. Now it's similar, but the only symptoms that get you, the only single symptoms that get you excluded from school and unable to come back without test 10 or an alternative diagnosis are ones that are a little more COVID specific. And they're cough, difficulty breathing or shortness of breath, and loss of taste or smell. The other symptoms on the list, you need to have 2 or more of in order to have to go through that whole test or 10 scenario. The fever, the chills, sore throat, headache, nausea, vomiting, diarrhea, fatigue, congestion. If you have a single symptom like just a headache, you won't get excluded from school as before. I mean, you will be, if you're ill, you still will be excluded from school, but you can come back when your sore throat or your diarrhea resolves without a COVID test. So it's sort of this is where we're going to see sort of the most change, I think, and the most loosening. And then I believe these are the same as before. And we're going to look at the new decision tree too, right?
Mhm.
It's probably a little clearer than trying to
Yeah.
read it out of the text. And again, parents are being asked specifically to limit their kids' participation to 3 cohorts and to limit their families' interaction with other families. And I think a more explicit way than before. The new decision tree is still somewhat busy, but a lot simpler than the previous one. The two starting on the left, the 2 blue boxes on the right refer to how to respond to symptoms. Either 1 from the first box or 2 from the second box.
Okay.
And then
sorry,
the
go ahead.
one, if you would just have 1 symptom, then siblings and household contacts are not excluded and they come back to school after they are better. And then I believe exposure to a COVID positive person is the same sort of thing. That is the main difference. I think it will be a little bit simpler to follow. Do not throw away your tier 1, tier 2 red decision tree. It is conceivable that we could be going back to it at some point. But hopefully that won't be the case. But and families do need to understand that things are going relatively well right now. We're moving to an easier thing, but that is not an invitation to, get together with 100 people, or because we will certainly be heading back to red if everybody kind of lets their guard down that much. So we still need to be putting out the message that we're still maintaining rigorous distancing, masking, all of the protocols that are in place, and that those are going to remain the norms, the community norms, and in the school community going forward until we have a vaccine. These, I really like the orange. That really looks good. These are the same scenarios. I believe the scenario 1 is changed to reflect the new constellation of symptoms. And what about the letters, Melina? Are they edited as well?
Yes, so the for scenario 1, we have the symptom card, which I mentioned before. That has both tier 1 and tier 2, and then also a tier 3 version on the same document. And then also the communications, we updated those, but really for scenario 2 and scenario 3, it doesn't really change too much as far as the actual communication, but everything is still linked in there.
Nice job, Melina.
Oh, thanks. I was really excited to color code it to orange.
Great. It's very clear, which then, as we get to know the tiers and the colors.
Yeah, and also just so you guys know too, we're going to leave up all the tier 1 and tier 2 documents on the documents page. So everything's going to be accessible. So should we go back, fingers crossed we do not. But if we do, everything will still be available on the website for you guys. Okay, so those are the new documents. I think now what we'll do is just go ahead and open it up to some questions. I actually had someone email me a question a little bit ago, so I'll go ahead and kind of read that one to you guys if you want to answer this. So if a school wanted to start an afternoon running or basketball skills program on their campus, would they have to amend their SSSPP? If it included students from different on-campus cohorts, like 2 different 6th grade class cohorts, would that be an issue?
If long as they would not have to change their SSPPs, as long as they're staying within the guidelines that are there for the sports and activities or camps. And then you also just have to consider the 3 cohort recommendations, that a
Right.
child's not in more than 3 cohorts. So that would count as a cohort as well as their school cohort, and then if they were in anything else.
Okay, perfect. Thank you. Okay, so we have another question here. Is Marin going to mandate a quarantine if families travel over the holidays?
As of right now, they are not. Right now, the recommendation is that that when you come home, there is no quarantine. I do know that there are physicians of the public health officers from the counties and from the surrounding counties are discussing this week. They're keep alert to the fact that there might be new restrictions. And then all of you that are coming from private institutions, you can make your restrictions stricter than the county is. So if you want to ask your parents to do that, then you may. We're just recommending that there's no quarantine upon travel
Okay,
at
great.
this time.
Great. Okay, so now that we are in tier 3, is this going to change any of the transportation guidelines or recommendations as far
No,
as buses? Okay.
no.
Okay, let's see here. Is there any more information about sports activities that are not school sponsored in or out of the state?
No, there are not anymore.
You want me to talk about that, Linda?
Well, I mean, I know that the big discussion right now is the fact of sports clubs that are traveling out of state.
Mhm.
But, and again, the public health officers of the surrounding counties are looking at that as well as looking at the travel piece, because those are our big dilemmas right now. And again, if you're a private school and you know of kids that are traveling out of state and participating in sports that aren't allowed in California, you can make rules stricter in your own institution. But as far as the county is saying right now, there are no restrictions when you travel.
Okay. Okay, somebody's asking about the scenario letters. So if you go to the Rethinking Schools website to the documents page and you click on the exposure protocols, all of those are live links within that document. So that's where you can find the links to all of the sample communications for all of the scenarios.
Yeah, and one of the things I'd like to bring up is the fact that the letter that the tier 1 and 2 had a sentence in there that said public health will be contacting you.
I took that out.
And by providing these letters, yes, we've cut that out, because by providing these letters, you are in essence notifying the family that they might be at risk. And from there, they need to go to their health provider to find out if they need to be tested or not. And it's really important when you're telling them this, that 5 to 7 days is communicated to them, that if they go immediately, because what happens is parents panic and they want to go get tested right now, and they go get their whole family tested and they get all these negative tests, and then 3 days later you get symptoms. So it's a matter of, you really need to wait until the people catch the disease. So you need to wait that 5 to 7 days before you test. And most of the physicians are telling them that. And so that's one of the reasons why we are referring them to their healthcare provider.
Okay, so let's see here. If students are using individual screens at their desks, so the plexiglass barriers, do the screens have to be assigned to just one student? So if in middle school, do each of those students need to carry them from class to class with them?
That would be a good way. If they're not going to carry them, then they should clean them off as they leave, so that the next person has a clean shield.
Okay. Great. Any idea when the travel guidance may or may not come out from the six counties that are currently discussing it?
That's a magic question. And no, we don't have a date.
Okay.
Well, I mean,
And it might not change at all.
we know that they met this week to talk about it, but nothing, we've received no indications about what's going to happen, and which only indicates to me that they're discussing all the nuances and maybe not everybody's buying into the same idea.
Mhm.
So we'll wait.
Okay. Okay. Do we have any other questions? Okay, let's see. So this is, not necessarily for this group, but it's an interesting question about the cohort numbers for licensed preschools in Marin.
The licensed preschools in Marin are
Yeah.
designated by the licensing board
Okay.
at the state of California level, and we have no responsibility on changing that number up from 14 plus 2 adults.
Great. Thank you. All right. Any other questions? I know you guys are probably all just itching to take these documents back and get them, kind of laid out with your schools. But maybe we'll wait for another minute here if anybody has any questions, or if you guys want to unmute yourselves and say the question yourself, you're more than welcome to as well if you don't want to type it into the chat box.
I'll say something. I just want to remind everybody that we don't want kids coming back to school if they vomited within 24 hours. We still want, these minimum safeguards that we had prior to COVID, just to make that clear.
Okay, let's see here. So just to reiterate, if a school, a public school chooses to, they can be more restrictive than what you guys are suggesting for tier 3.
I'm not sure public, I said private.
Oh, if it's a private school, okay. What about public?
I don't know the legal ramifications for that, so I would refer to your own.
Maybe the district.
Yeah.
I
Okay.
think we are discouraging that
Mhm.
because a lot of families have kids in multiple schools and institutions. And the idea of the tiers is to kind of keep everybody with a consistent protocol in hand.
Mhm.
That and the protocols are responsive to sort of community levels of COVID. So schools are free to be more strict on various aspects of the guidance that we put out, although not more lenient. But I do think that it would probably be suboptimal for a school to implement very strict guidelines unless there are some special circumstances.
Okay, cool. Donna, would you like to unmute and ask your question about cohorts? I'm not sure I understand the question.
I'll try. Just the recommendation is students should not participate in more than 3 cohorts. So we've, of course, only had 1 cohort per student at school, but wondering if there's any loosening now so that a student perhaps could be seen in a small group with a student from another cohort.
I think, yeah, I guess what I would like to say is that the 3 cohorts is community based, right? So kids could be in cohorts outside of school. So if you start increasing cohorts in school and parents have them doing other activities, you're widening it. And that's not my understanding of that directive. Linda or Sandra?
No, you're right. Exactly. It's that 3 cohorts. And so if they got together with people from a different cohort, that makes a new cohort. And that's what the family needs to count that as a cohort.
So it might take them out of a music enrichment program.
Right.
Yeah.
Okay, let's see here. This is actually a really good question, just as far as, tracking is concerned. So how are we marking the kids with mild symptoms, and how are we keeping track of those kids?
At your schools?
Mm-hmm.
Well, wouldn't that be up to you as the PHL and your task force to decide how you're keeping track of your kids?
Yeah. I mean, what we've kind of discussed a little bit was just having a big, Excel spreadsheet. So if a kiddo is out, then you have it there. You have the first day of symptom, and then you have the day that they're allowed to come back. Obviously, kiddos are going to have a lot of scenario ones. So there's going to be a lot of kind of moving parts with all of that. So coming up with some sort of tracking system so that you're making sure that kiddos or siblings aren't coming back before they should be back in school is going to be really important. And probably maybe you can kind of tie that to the attendance part of tracking as well. Let's see here. What are the protocols around in-person volunteers? And I will just really quick say that guideline number 29 on our 30-point plan talks about non-essential visitors being restricted from the campus. But now that we're in tier 3, is that going to loosen a little bit?
Not to my knowledge, no. It still is, non-essential people should not be on campus.
Okay.
What if we're not able to operate without volunteers? Like we're at a place where we're just really struggling, given our number of teachers that are on campus trying to teach hybrid and it's just not working.
I think,
Then they become essential.
yeah. I mean, if you're using unpaid people instead of paid people, that doesn't really have any effect on the overall germ pool at your school. So it's really just a matter of what's practicable, but you don't want to have a lot of sort of unnecessary traffic.
Okay, great. Thank you.
Well, would they not then have to follow the same protocols as an employee at this point in terms of maybe potentially
Checking in every day, yeah.
Yeah, and yeah, symptom monitoring and
Testing.
I'd have them sign a waiver that they're
through an organization that actually takes care of all the liability issues and fingerprinting, all that. It's through Bridge the Gap. So
that's good.
So then Emily, then they become essential workers.
Mm-hmm. Yeah. And again, it is about essential. So, if your copy machine's down, at some point, the copy machine person might have to come in. But again, it's about tracking, making sure they're checking in, asking the health screening questions, and, going through all of the right protocols. That part's going to be very important. Let's see here. Okay, so we're talking middle school now. We're counting all the contacts in a day, even as they change classes, as one cohort. In other words, are all the contacts at school considered one cohort?
No, not necessarily. Because if a child was in a school cohort and then went to a football practice, those would be considered two different cohorts. Now, a lot of the junior high schools have fixed it so that the teachers are moving and not the students, and then they move the students that have to, like in math classes and that, to a different cohort. But then you have to keep track of the number of cohorts that student is in.
Can I speak?
Yeah,
Yes.
of course.
Hi. So that's really different guidance than we've been getting elsewhere. So our understanding, we're told that students don't even need to be completely cohorted. We started off with trying to keep, our students are going to 6 classes. And for the most part, we keep them together, but it's not perfectly. And we were told that even 100 contacts is not too many. The only reason it was 100 was because of contact tracing.
Right, and I actually think I heard the number, Deborah, in different places as 125 at middle school and high school of the max type of piece.
They're in the 30-point guidelines were changed. So the original back in June had middle school and high school of up to 100 students could be in a whole cohort. They've removed that, and there is no cohort number for middle school and high school. So I also think what we have to do is separate out students being in a cohort versus a teacher or an employee working, because the teacher isn't part of the cohort. You may have different teachers coming in and out working with the kids. It's the kids who are cohorted, not the teacher working with the kids. So I just think that there needs to be, because I'm not sure that question that came in a little bit earlier was thinking of the students with a teacher as being a cohort versus what the students are doing and maybe coming into contact with multiple adults throughout the day.
Right, but what I think the other language was, Marcy, that if you send us a line list, you would have to send us those teachers that worked with those
Absolutely.
kids
Yeah,
in that.
absolutely.
Yeah.
But I think in terms of counting students as being in how many cohorts, it's not the number of teachers they may come into contact, it's the student.
Right.
The student group makes a cohort.
I understand that, but if we're saying that a student cohort is unlimited, basically, which is what the doctor said, then like the question that you answered before, like can a person from one class work in a cohort with another class? And you said no, that's 2 cohorts, but middle school students are going to be in lots of cohorts. They could technically be apparently up to 6 cohorts, 6 different groups of students.
Okay, so I was under the impression in junior high school that you were planning classes, when I'm reading the SSSPs, that you were planning classes so that the kids would not necessarily be in 6 different ones, but they would be with as many as they could in the same cohort. And that cohort number, but that's one cohort. So if one of those students becomes ill, that whole cohort closes. Like if it's 100 people, that 100 people are quarantined.
That makes sense.
Is that better? More clearer?
But the school cohort is the school cohort, not the fact that I'm not in 2 cohorts because I'm tightly cohorted for 5 of my classes, and then 1 class I'm in band with another cohort.
Now, see, if you do a band, then I think I will double check with Lisa and Matt, but right now band is being discouraged. So
Okay,
they shouldn't even be in a band. So that would become a different cohort.
Okay.
Well, I think people can offer band as long as they're restricting the blowing of instruments. So you can do a lot in a band class without actually playing an instrument to still keep. So I think just with that example that Deborah used, I think the question's a good one because that made me think a little bit more about what does that mean in a junior high, middle school, or a high school, is if there isn't a cohort number for them, is what I think Deborah's asking is then if the kids are able to move around throughout the day into different classes as they might need to be, as they're scheduled, then it sounds like in a middle school or a high school setting that school is a cohort, or that grade is a cohort, that group of kids. But I hear what you guys are saying too, that if that cohort is up to, let's just make it up for fun, that it's up to 90 people, if that cohort does close, then it is 90 people, plus all the adults they may have come into contact with. So that is a really interesting concept when, as some of our schools aren't open yet, and we're still trying to, in our middle schools, high schools, they're still trying to plan for that. Mm-hmm. That's really important because that contact tracing is going to be huge.
Yeah,
exactly.
And the tracking of where everybody's going.
Right. And that's why when I was reading the school site plans, they really were looking at trying to keep the kids together as much as they could in the smaller groups.
Yeah.
Yes, they can go up to 100, 125, whatever the newest number is, but that most of the schools were at this point trying to keep it down and keep the kids together as much as they could.
And it sounds like Deborah's school's already open in this model. And
no, we don't open until the 30th.
Okay. All right. All right. So, but that's, I think, a great question for to go back to Lisa with is for a junior high, middle school, high school, where the kids are in departmentalized classes, and they're not where in some schools are operating what's called the advisory model, where the kids stay in one class all day and it's the adults who move through. But if the kids are actually going to move, and the schools can figure out a way to make that happen, where they're uniformly moving throughout the school, they're not mixing in the cohorts or whatever, coming into less than 6 feet or 4 feet, whatever the schools have designated, then how does that work in terms of the counting of the cohort if the children are supposed to be in no more than 3? And my guess is that's all the way up through 12th grade, is that 3 cohorts is not just elementary, it's all grades.
Correct.
Okay.
Yeah, and I think whatever you end up in your school, that is your school cohort. So whatever classes they go to. Now, the reason when she said music, the music and band have been something that have kind of been isolated off because of the risks of them and the, you know, the blowing of droplets. And so they're like, you can do this stuff. They're encouraging you to do it outside. So at this point, I will check with Lisa and Matt, but I have a feeling that music and band are going to be a different cohort.
Yeah, I just use that as probably a bad example. I probably should have said art.
Yeah, art. So that one just has a complication in it that is different than the others. But your cohort, and on a given day, your kid, whoever that kid with symptoms is going through those classes. Those are the ones we have to keep track of. And that's why the hybrid or keeping the kids together in their certain classes, like their basic English, history, and that kind of stuff, keeping them in one classroom together and not spreading them out as much, and only spreading them out in their math type classes or accelerated classes, then you have a smaller impact. You have less chance of spread. You have a smaller impact if there is a positive case. And I mean, we don't want to close the schools down as soon as we open them. That's the goal.
All right, so we're going to get a little bit more clarification about that question, and we'll report back next Thursday. It's a little bit after 3:30 now, so we're going to go ahead and end. We'll have this recording up on the website within 24 hours. I want to thank Linda, Marcia, and Sandra again for joining us today and answering all of these really great questions. And if you have any questions about the actual documents, or you're having trouble accessing anything, you can always email rapidresponse@marinschools.org, and that goes to our entire task force here, and we'll make sure we get back to you with the correct documents or any kind of clarification that you need. So thank you guys very much, and yay orange tier. I'm really excited to have a little bit more freedom, well, not freedom, but a little bit less restrictions getting our kids into school, into in-person learning. So thank you guys very much for joining us. And as always, we will be on again next Thursday at 3 o'clock. You can use the exact same link for all of our meetings moving forward. Thanks a lot, everybody.
Thank you.
Thank you.
Bye.